Good morning, good afternoon, and good evening, depending on where you are joining us from. Thank you very much all for joining us today. It is indeed a privilege for us to have such distinguished group of speakers, participants that have joined, some key stakeholders that are also gathered here, some of whom will also give us some address on one of the most pressing health challenges of our time, which is the antimicrobial resistance known as AMR. It is also humbling for us as the African Society for Laboratory Medicine that in today's webinar, we are also joined by the Honorable Minister of Health from Malawi. We are also joined by other distinguished members from PEPFAR, from the World Bank, from Africa CDC, and many of you coming from different stakeholders within the continent as well as beyond. This is indeed a true spirit of what in Africa we call Ubuntu, which is we move together because we are, because of who of others that have made us. So in today's webinar on implementing the Africa Declaration on AMR, a path forward from the 74th UNGA high-level meeting, is both very timely and also very critical. As we all know, AMR is a growing threat that could reverse a decade of many progress that we have made medically, scientifically, in the public health space, socially, economically, and politically. It is also making some of the common infections, making them now harder to treat, thereby increasing the risk of complications and in some instances, death. We all know from reports that have been published widely that if left unchecked, AMR could actually push millions of people, millions of our general population, particularly here in Africa, into poverty, thereby placing immense strain on our unfortunately already stretched healthcare systems. By doing so, this then endangers the success of the Sustainable Development Goals in Africa, as well as globally. In this region in Africa, we have long decided to tackle AMR by its own. This issue is particularly very, very urgent here in Africa, where, like I've said earlier on, healthcare resources are already stretched very thin, where high disease burdens and limited access to essential medicines, limited access to diagnostics has made our population here in Africa particularly very vulnerable to the effects of antimicrobial resistance. We are very glad of the declaration that recently happened in New York at the United Nations General Assembly, where a lot of our political leaders endorsed this declaration on AMR. And this has set an agenda for action for all of us collectively in order that we can tackle this public health threat and emergency. But as with any agenda, the real impact lies in implementation. We have many declarations that have ended just as declarations, but really the impact lies in implementation, in ensuring that the policies that we come up with in countries, the partnerships that we forge, the innovations that we come up with really translate these declarations into measurable progress on the ground where our populations are, where our communities are, where our mothers, our brothers, our sisters are being affected by AMR. So there are certain things that are very clear, things that we need to do, and we need to do them as of yesterday. Firstly, collectively, we need to work together to further highlight the declaration on AMR that was done in New York a few weeks ago, as well as highlight the Africa Landmark Report on AMR, in order that we can clearly articulate the current status of AMR in the continent, while at the same time emphasizing the critical role, emphasizing on the significance, and emphasizing on the implications that this declaration, this landmark report has on our African states as key milestones. Secondly, we also need to be very clear in coming up with measurable, funded plans on how to integrate this declaration into our national action plans. In other words, what are those turning point strategies that we need, that are embedded in this declaration, that we need to ensure they become part and parcel, they become part of the routine implementation of our national action plans on AMR. And lastly, we really need to cast our eyes into the future and have a clear vision by defining a roadmap for steps that will ensure a sustained action, that will ensure increased investments, that will emphasize the declaration as a milestone in combating AMR across our African continent. I therefore am very happy today that we will delve into some of these areas on how we as an African region can also move forward from commitments made at the 74th United Nations General Assembly and moving forward. In this webinar today, we will discuss some of the steps that are needed to strengthen our laboratory and surveillance systems, some of the critical things that we need to do to improve policy alignment across sectors, and most of all, to increase awareness, to ensure there's accountability around antimicrobial stewardship. It's an everyone's problem. If one member state is left behind, we are all not going to progress. Our speakers today, they represent a wealth of experience, a wealth of expertise. They will share some insights on some of the challenges, as well as some of the successes we've had in implementing AMR strategies. And most importantly, be able to discuss and share with us some of the best practices that can guide us going into the future. As participants, we also are encouraging you to participate through our chat. Your perspective and questions will be crucial for a productive dialogue that we can have today. So once again, I encourage you that during the course of this webinar to continue to actively engage in our chat box. Some of our staff in the background will also be answering some of the questions. Now, this webinar is critical because it allows us to bridge the high-level policy commitments that we have made into, like I've said before, actionable on-the-ground strategies. It's a chance, and chances don't normally come many times. It's a chance for us to discuss the challenges, share successful approaches, and most importantly, build a coalition that supports the Africa's declaration vision on a future we are effectively managing AMR. Thank you all for being part of this vital conversation. And once again, I look forward to engaging, to an highly interactive engagement and also productive session. So without wasting more time, let me right away dive into our exciting agenda today by first of all calling upon the Chief Executive Officer for the African Society for Laboratory Medicine, Mr. Ndlovu, to set up the stage with his opening remarks. Mr. Ndlovu, say, over to you.
Thank you so much, Dr. Tokmo, and I want to say good morning, good afternoon, distinguished colleagues, honored guests, and esteemed participants, and depending on where you are. I want to give a special recognition to the Honorable Minister of Health from Malawi, Honorable Chiponda. Thank you so much for making the time to be part of this conversation. We are very privileged to have the country voice, the ministry voice into this conversation, especially following this declaration on AMR. We really look forward to the countries leading this conversation, and more so even in the implementation. So we are very honored to be having you for this next 1 hour and for making time for this. I know you have a very busy schedule, but because this is important and also dear to you, we are very honored to be having you in this webinar. So it is a privilege to welcome you all, and I also want to welcome and recognize the presence of our partners from PEPFAR, the Africa CDC, represented by Dr. Yewande. Thank you so much for making the time to be here. I also want to recognize the presence and the critical role of World Bank. Thank you so much for making time to be part of this engagement, the continuation from the UN declaration. So today's webinar is going to be focusing on the critical issues of implementing the declaration. So we are excited because this webinar is the first, maybe, coming just soon after the 74th, UNGA higher level meeting, where the African Union member states, they reaffirmed their commitment to combating the rising threat of AMR, a threat that poses significant challenges, not only to the global health, but also to our economies, food security, and even environmental sustainability. As we all know, AMR represent one of the most urgent global public health challenges of our time. It transcends borders and disciplines, and it's impacting people, animals, and even the environment. And this declaration from the UNGA meeting on AMR stands as a testament to our shared commitment to addressing this issue in a coordinated and impactful way. So today we gather here to explore the path forward. We know our challenges, but we are more interested in the path forward, and especially how we can translate commitments from this political declaration into tangible actions across the African continent, as already indicated by Dr. Tokmo. So as ASLM, we are very dedicated. We remain available to support this collective effort, recognizing that diagnostics and laboratories are at the forefront of the AMR response. So we are going to hear a lot from the experts that are here today, as already indicated by Dr. Tokmo. So it is my hope that today's discussion is going to inspire further collaboration, spark some innovative solutions, and pave a way for coordinated action that reaches from the local level all the way to the global stage. So thank you so much for joining us today, and I'm looking forward to the fruitful and inspiring dialogue today. Thanks, and over to you, Dr. Tokmo.
Thank you very much, Mr. Ndlovu. And we really echo your words that where you say, as ASLM, you really reaffirm your commitment of supporting member states in the Africa region with many other partners that you have mentioned to ensure that we strengthen diagnostics, which, as you have said, is a cornerstone and a pillar when it comes to strategies to combat this emergence that you have mentioned, which is AMR. And in your remarks, there's something very important that you said. The country voice is very important. The voice of the member states where our populations reside, where people are being affected by AMR. So what an honor it is for me at this particular time to introduce the Honorable Kumbize Chaponda, who is the Minister of Health for Malawi, who, from my own perspective, is a certified advocate and champion for health system strengthening in Africa, particularly in this area of AMR, where from the time that I've known her, she has never been shy of being vocal about what we need to do as countries, what we need to do as a region. The Honorable Minister will deliver the key messages from the UNGA Declaration on AMR. She will talk about what were the key messages from UNGA. What is it that we need to do as member states? And also, very importantly, what support are countries asking for? In other words, what is the call to action from the voice, from the perspective of the African Union member states. Honorable Minister, the floor is yours.
Thank you so much, moderator. Good afternoon from the warm heart of Africa. Good morning, good evening. Let me thank the organizers for organizing such a very important meeting coming after UNGA. Malawi, we remain committed to the declaration which was made there. Ladies and gentlemen, indeed, it is an honor to welcome you all to this very important webinar where we gather to address one of the most pressing issues of our time, antimicrobial resistance. This topic, which rightfully took center stage at the recent United Nations Assembly, underscores the need for collective regional action for our continent, Africa. Unfortunately, as we are talking about this very important topic, antimicrobial resistance, we should not forget other pressing issues which our member states are facing. We have our member states who are fighting mpox at the moment. We have our member states who are fighting drought at the moment. We have member states fighting conflict at the same time. So there are many competing priorities which member states are facing. So we have to keep this in mind while we are discussing this issue, a very important issue of the burden of antimicrobial resistance. Antimicrobial resistance is a crisis which is far-reaching implications for human and animal health, food security, as well as global development. As we all know, the misuse and overuse and indeed abuse of antibiotics and other antimicrobial agents have accelerated the development of resistance, rendering many of our life-saving drugs less effective. If left unchecked, AMR could claim 10 million lives each year by the year 2050 and cost the global economy over 100 trillion US dollars. And these are the lives which we have already spent so many dollars, millions of dollars, saving them from HIV, saving them from tuberculosis, and many other gains which we have made as a continent. The declaration from the UN General Assembly on AMR is a significant milestone. It sends a unified from quadripartite leadership urgent call to action, emphasizing that addressing AMR is not a responsibility of any single country, but a global imperative. This declaration, while reaffirming the global commitment to tackle AMR as a major public health threat, including reducing estimated 4.9 million human deaths associated with antimicrobial resistance annually by 10% by 2030, highlights three critical pillars for action. The first one is being emphasis on the urgent need for one health approach addressing AMR across human, animal, and environmental sectors. Second is the promotion of sustainable investment in AMR research, diagnostics, and treatment. And we know, as member states, the challenges which we have, especially in research and diagnostic as well as treatment. And the third one was a call for stronger regulation and monitoring of antibiotic usage. Each of these areas requires cross-sectoral collaboration and sustained commitment from governments, private sector, international organizations, civil society groups, as well as the citizens themselves. As member states, the declaration calls for us to act and to act now. There is need across the countries to strengthen our national action plans to prevent and manage AMR. Also, it calls for us to enhance surveillance systems to track AMR patterns. It also calls for us to improve infection prevention and control practices in healthcare facilities and community settings. We also need to invest in water, sanitation, and hygiene infrastructure and policies as a key area in addressing AMR and fostering partnerships with industries to ensure a responsible use of antibiotics in agriculture and food production. All this will be possible if countries or indeed member states are supported with financial assistance in implementing AMR action plans. And we are able to access to affordable diagnostics, vaccines, and antimicrobial medicines. And we are provided with technical expertise to improve laboratory and data analysis capacities and guided on best practices for AMR policy development and implementation. As a country, Malawi, we have made a commitment to the declarations. The global nature of AMR means that no single country can address this alone. Therefore, Malawi is committed to implement the declaration. This requires collaborative, cross-border initiatives that encompass human health, animal health, as well as environmental safety. By reaffirming our dedication to tackling AMR, we commit to several core actions through implementation of the following national action plan strategies through the One Health approach. The first one is awareness and advocacy. This is needed to raise public awareness about antimicrobial resistance and promote responsible use of antimicrobials. Colleagues, you are aware of the situation in most of our countries. You find antibiotics in the streets, in the sun, in the markets, and there's gross abuse and misuse of antibiotics. Furthermore, there's also the issue of fake drugs or indeed drugs which are not registered, which are commonly used by the citizens. The second one is being surveillance systems. We need to strengthen monitoring systems to track resistance patterns and guide policies and responses. The third one is being research and development. We need to foster innovation in new antimicrobials, in diagnostics, and vaccines to combat evolving resistances. And the fourth one is responsible use, to ensure responsible antimicrobial use across healthcare sector, in agriculture, as well as other sectors to slow resistance development. In addition, the government calls for strong regulation and monitoring of antibiotic usage by strengthening the initiatives being implemented by the pharmacy and medicines and regulatory authorities in the countries. In conclusion, colleagues, today as we discuss these critical areas, following the landmark commitment by Africa Union member states, I'm thrilled to hear from experts who are actively working on strategies to combat AMR and share how the UN Declaration aims to support and amplify these efforts across Africa, and indeed the investment which is needed to combat AMR. As we proceed, I encourage each one of us to reflect on how we can contribute to this fight, whether through advancing research, which is very important, whether through advocating for policies as executive branches of our governments, or indeed by just raising awareness. Community involvement is very, very important. Community awareness is very, very important. Each one of us plays a vital role in curbing the spread of antimicrobial resistance. Thank you all for your time and commitment, and I look forward to a productive and indeed inspiring discussion today. And thank you so much, and thank you, moderator.
Honorable Minister Kumbize Chiponda, thank you very much for these very insightful remarks, giving us the message that you are delivering from the 74 United Nations General Assembly in terms of what the declaration means to us, what the declaration means now, and what the declaration means going into the future. You highlight some of the key important aspects from this declaration. I think about 5 or 6 key issues that you raised. Firstly, the need to ensure that we strengthen the implementation and resourcing for our national action plans on AMR. In other words, turning this declaration, this commitment into action on the ground. Enhancing surveillance systems for AMR. We cannot tackle what we don't know. So we really need to measure what it is, what is the burden of AMR, and be able to track and improve our surveillance systems, infection prevention control, WASH, as well as partnerships with industries to make sure that regulation for some of these antibiotics is effective. So thank you very much, Honorable Minister, for delivering this very important message coming out of the 74th United Nations General Assembly. Now, moving on, one of the critical elements when it comes to implementing any sustainable investments or any sustainable interventions regionally, globally, and nationally is partnerships. Honorable Minister mentioned that we need to have these trusted partnerships with many of the stakeholders following a One Health approach. So the role of our development partners cannot be ever emphasized in this problem that we have in the House. Our renowned as well as trusted partners have stood with us during the good times and stood with us even during the bad times. In Africa, we have a saying, if you want to travel fast, simply go alone. But if you want to travel far and further, go together. One such partner that has stood with us is the United States government through its President Emergence Plan for AIDS Relief, PEPFAR. So today, we are joined by Dr. Kane Dokubo, who is the Deputy Coordinator for PEPFAR, who is going to speak to us on the critical role of the Africa Declaration on AMR in terms of the role that PEPFAR program will play in advancing and supporting the actualization of this declaration, while at the same time also aligning with the strategies and objectives of the PEPFAR Global Health Security Strategy. Dr. Kane, it is indeed an honor for you to join us in this webinar, and I would like to give the floor to you. Thank you.
Excellent. Good day. It really is a pleasure to join you today to address the critical issue of antimicrobial resistance to AMR. I'm Dr. Emily Kaine-Dokubo, and I serve as the Deputy U.S. Global AIDS Coordinator for Program Quality at the President Emergency Plan for AIDS Relief, PEPFAR. And on behalf of Ambassador John Nkangasong, the U.S. Global AIDS Coordinator and Senior Bureau Official for Global Health Security and Diplomacy, thanks to the African Society for Laboratory Medicine for organizing this important forum. Honorable Minister Chiponda, leadership of ASLM, representatives from Africa CDC, the World Bank, and colleagues, it's an honor to deliver remarks today and to join you in this important discussion. Now, as underscored during the recent UN General Assembly high-level meeting on AMR, the need for action to address antimicrobial resistance is more urgent than ever. AMR really poses a significant threat to health, development, and global security. And it's a challenge without borders, one that demands unified and immediate action. To that end, the United States government is actively addressing this challenge by integrating AMR strategies across our programs. And AMR posing a significant risk to HIV treatment effectiveness and the broader health landscape has made it a priority for GHSD PEPFAR to implement infection prevention and control measures to promote appropriate antimicrobial use, build laboratory capacity to monitor and manage resistant infections. And these efforts align with both national action plans and the Global AMR Declaration, ensuring that PEPFAR-supported programs foster resilience and sustainable health systems to combat AMR alongside the HIV pandemic. Efforts to combat the global threat of AMR are very important, especially now. And the Africa CDC and Africa Union's landmark report reminds us that we are nearing a tipping point. In 2019 alone, nearly 5 million deaths worldwide were attributable to AMR, with over 1.2 million people deaths directly attributable to resistant infections. Tragically, Africa bears the highest burden, and sub-Saharan Africa saw over 250,000 lives lost to AMR in 2019, surpassing even the mortality rates of HIV and malaria. These statistics are sobering, but make it clear that AMR is not a distant threat. It is here, and it is pressing. And so urgent action is needed now. Now, at the high-level meeting held at the UN General Assembly, the United States joined hands with global leaders and partners across Africa to endorse the AMR Political Declaration. This declaration represents a new chapter in the global response to AMR, embodying the shared political will and commitment necessary to drive action. Together, we have committed to strengthen national AMR action plans, intensify efforts in infection prevention and control, and reinforce oversight of antibiotics to ensure their appropriate use in health and agriculture. In addition to these strategic steps, we have set ambitious but achievable targets, and that by 2030, a little over 5 years from now, we aim to reduce global deaths from AMR by 10%. This target is more than just a number. It's a lifeline, a measure of progress, and a challenge to each of us to push harder for meaningful change. The priorities of this political declaration align directly with PEPFAR's mission. Both the declaration and PEPFAR's mission emphasize the importance of resilient health systems, sustainable health security, and global collaboration to address health threats. Combating AMR is not only critical for Africa or the United States, but is essential for our shared global health security. We commend the commitment and work of all the partners who are engaged in this effort. And we ask that we continue to work collectively, build resilient health systems, and ensure that AMR remains at the forefront of our global health agenda. Because working together, we can turn the tide on this challenge and protect future generations. Thank you.
Thank you very much. Thank you very much for these very insightful and welcome remarks, Dr. Cain from PEPFAR. And we really appreciate your presence, especially sharing with our audience here how the strategies for PEPFAR, for global health security agenda, are really aligning with the AMR declaration, as well as some of the strategies and priorities and challenges that we are facing at member states level. I think you highlight very important points in your submission. Firstly, just to really emphasize that the need for action to combat AMR is actually now, it's more urgent. And this is not a distant threat, but a threat that is there now. And you really emphasize on the need to integrate AMR across all programs that are implemented across our member states. And we are very grateful that in some of your latest global health security strategies, this has been prioritized. You have indicated priority in ensuring that you support implementation of national action plans, strengthening of infection prevention and control, as well as support the regulation of use as well as distribution for some of these antibiotics. These are three very critical strategies that will ensure we translate some of these global commitments into actionable plans. So thank you very much for those remarks. So now, also I continue to encourage our participants to, if you have any questions, continue posting them on the chats. Our team in the background will also answer some of these questions. And whenever there is need for us to post or discuss some here in plenary, we will bring them forward. Now, they always say action speaks louder than words. I want us now to move into real action. What are some of the ABCs actions that we need to undertake to make the dream of controlling AMR become a reality? And to help me to do that, I have once again 3 very distinguished panelists who are going to help me navigate this important section of our agenda, turning these global commitments into actionable, real plans on the ground. So first of all, I would like to call upon once again our Chief Executive Officer from ASLM, Mr. Ndlovu, to set the stage for us once more. So Mr. Ndlovu, the African Society for Laboratory Medicine is a Pan-African organization that now has a very large footprint in Africa, especially in the area of laboratory systems and network strengthening and diagnostics. So we would like to hear your thoughts that now that we have this declaration under our feet, from your 13 years of experience in implementing programs and projects in Africa, how can member states integrate the AMR declaration into the country priority areas? In other words, how do we make sure this does not become yet another political declaration on paper? Over to you, Mr. Ndlovu, for your input.
Thank you so much, Dr. Tokmore. I'm really, I feel heartwarmed, especially speaking after the Honorable Minister has given the country voice, and also listening to the PEPFAR a team also weighing in terms of that the need for action is more urgent now than ever more. So I think I'm going to reflect on a couple of points. I have around 4 points, but I'll just touch on the first two so that I can also leave time for other colleagues to also intervene and make some remarks. So I think first and foremost, if we are going to talk about member states integrating AMR declaration, I think it starts off around the recognition of the agents of AMR in Africa. So currently, we need to shift from AMR being treated as a separate problem, because right now, the public health threat that is now posed by AMR in Africa is quite huge. It's already established that AMR is now killing more people than HIV, TB, and malaria, and it's now threatening even the gains that we have made, through the HIV, TB, and malaria programs. And, the lives that we have saved, as already indicated, are now going to be lost. So that already increases the urgency and also the critical attention that we now need to pay to AMR. So that by itself, I think, really should raise the profile. Already, AMR is responsible for an estimate of around 700,000 deaths globally each year, and this number is projected to rise to 10 million annual by 2050. So already AMR is becoming a huge challenge, and we cannot look at AMR and address AMR separately. So now countries will need to begin to look at AMR and see how we can integrate AMR responses into national development goals, how we can align even our response to AMR to some of the national health priorities. So looking at the problem right now, it's a huge problem, it's a huge challenge, especially in Africa, where almost 22% of the global AMR deaths are actually in the African region. So that's already is setting AMR to be a priority in the continent. And we cannot do business as usual. So AMR has to become part of the national priorities. And we have to, it will need to have a multi-sectoral approach, bring the agriculture, bring the environmental sector. So these are some of the, I think, important points that we need to start thinking about, because it's no longer an isolated issue. It's already affecting even some of the gains that other programs have been actually registering for all these years. So we need to begin to look at it as a national priority. We need to look at it as a health security issue. We also need to look at it as an intervention that will also help us achieve even universal health coverage. So let me stop here for now and also leave time for my colleagues. Over.
Thank you very much, Mr. Ndlovu. I think you point out some very key, important actions that we need to do now. And you mentioned quite rightfully that this issue is also echoed by the Honorable Minister, echoed by the earlier speakers, that the agent is not a future. It's not a future threat, but it is a threat that is real now. So you emphasize the need to recognize the agents of AMR, the need to ensure that we include AMR into national development plans. So it's not a human health issue. It's not an agriculture issue. It's not an animal health issue, environmental. It's also a social issue. It's an economic issue. It's a political issue. So as member states, you are encouraging them that we need to integrate the AMR response into national development goals. I think a very important point. And this speaks to ensuring that we include AMR response into the national action plans. Critical also, you mentioned the approach of a multi-sectorial approach. So it's not a one sector problem, but a multi-sectorial approach. And as we approach AMR response, the need for One Health response is going to be very critical. So thank you very much for these very tangible action plans that we need to implement as we translate from this declaration into actionable plans. Now I would like to also call upon Dr. Wande from the Africa Centers for Disease Control to also weigh in terms of what are some of the key issues we need to pay attention to and start thinking about as we translate these declarations into actionable plans. So Dr. Wande, recently Africa CDC was granted the wish that all of us had with a new stature endorsed at the 45th Ordinary Session of the Africa Union Executive Council in Lusaka, July 22, as an autonomous health institution of the Africa Union charged with the responsibility of preventing and control of disease in Africa. So this is a very important and strategic milestone for all of us, as well as for Africa CDC, as it strategically places Africa CDC to take its role in Africa. So Dr. Wande, what role then does Africa CDC envision to play in ensuring the implementation of this declaration? In other words, where and how would Africa CDC come in to translate this declaration into action? Dr. Wande, the floor is yours.
No, thank you very much, Dr. Tokma. Really good to see you again. And good morning, good afternoon, evening to colleagues joining us. Really, on behalf of the leadership of Africa CDC, Your Excellency, we're really honored for you to join us today in this exciting discussion. I think the leadership that you have shown, even when we were in New York, was quite outstanding. But most importantly, I think this session really showcases what we really mean by the Africa we want. And I really thank you so much, Mr. Nlovo and team, for taking the remarkable leadership in this. I think it's been 1 month since we were all excited to gather to New York again for the second time to discuss this pertinent issue of AMR. But most importantly for the African continent, it was a good opportunity for us to reaffirm what our heads of state have made commitment to the African common position on AMR. Ladies and gentlemen, I think one of the things that I really like to tie together is that a lot of efforts have been made on the African continent. We really are proud, incredibly proud of the various sort of successes that our member states have really shown in terms of AMR control strategies. I think one thing that is critical is the political declaration is very important, but how do we ensure that it's not just words on paper? And this is something that a lot of colleagues have already alluded to. And I'm quite pleased that with the collaboration that we have together with ASLM and other partners, we've been able to document this. This is not just assumptions again. This is not just, oh, we need IPC. We've been able to document clear evidence in terms of what the key strategies for the African continent should focus on. So in terms of what Africa CDC will be doing, in terms of Africa CDC being the autonomous public health agency of the African Union, it's really to continue to do the efforts that have been done in the past. But now we are doing it with more guidance. Ladies and gentlemen, in 2015, when we started the discussions around having a political declaration elevating antimicrobial resistance, we couldn't quantify the problem as Africans. We were looking at the O'Neill report, which said projections by 2050, really valid evidence to really build up the case. But since then, it's important for us to take stock of the progress that has been made. For example, the MAP study that was done together with ASLM was able to put together the first of its kind granular data that really defines Africa's problem. So the question is not what is new that we are doing. How do we reaffirm, reassert some of the strategies that work for the African continent? Allow me to bring a few points that we have considered are really crucial for, which is reflected in the report. And ladies and gentlemen, we'll put the report in the chat as well so that you can reflect on it. And this is where Africa CDC really encourages member states to look at, work with our international partners, our continental partners to be able to implement. It's around the issue of strengthening governance. And this really looks at it in a broad One Health approach. This is where leadership comes into play. I think for us right now, we are really proud because now Africa is saying leadership. We have Honorable Minister joining us in this exciting technical session. This is how we showcase leadership. Our ministers, our heads of state are getting actively involved on the issues of AMR. For example, in Tanzania now, they're currently doing an AMR parliamentarian training, whereby they're training parliamentarians on issues around AMR, guiding them on how to make informed decisions. In a few weeks, all roads will lead to Saudi Arabia, Kingdom of Saudi Arabia, for the Jeddah meeting, the 4th Ministerial meeting. We as Africa CDC are quite pleased that we are going to be working with our 55 member states to ensure the representation of ministries of health, environment, as well as agriculture to really reaffirm the One Health approach. Very quickly, I think that has been said that the issues that drive AMR on the African continent are very layered. They're very nuanced. We have several outbreaks, like Honorable Ministers has mentioned, the issue of climate change that many of our countries are experiencing. Dr. Tokma has really highlighted that the resources are scarce. For health-related issues, we can all agree that the resources are just not enough to deal with a lot of issues that LMICs are dealing with. But it's important for us to prioritize what can work for the African continent. For example, infection prevention and control, as well as WASH, is a proven cost-effective intervention that takes care of not just AMR, but takes care of several other infectious diseases on the African continent. We think about issues such as vaccination. We argue that if you're able to get equitable vaccines to children, we might perhaps reduce the need for antibiotics. We might perhaps reduce the need for them to go to hospitals and be exposed to hospital-acquired infections. Reflect the same in the agriculture. If we have good animal husbandry, biosecurity, we can ensure that farmers don't need to use antibiotics. What are the measures that we need to take in that regard? There comes the issue of course, equity, which we have tried to put together, make a strong case. I think you're quite aware that we are currently really moving towards ensuring the continent has the adequate local manufacturing capacity. And it's not just for vaccine, it's also for medical products such as therapeutics, diagnostics, which are really relevant to issues of surveillance, which has been alluded to in that report. I'm really tying it very quickly together. It's around also evidence building, thinking about surveillance. I think more often than not, we think there's one single solution to AMR. Ladies and gentlemen, if there was one single solution to AMR, we would have solved it because we have brilliant minds like a lot of the speakers you have said, really coming together to develop strategies. But AMR is so complex. And as such, we really need to ensure that we have all the relevant players on the table. So from the Africa CDC side, one of the things we're calling on is not business as usual. It means that when international partners want to work with our countries, you work through the AMRCCs, which is the coordinating mechanism in the country. This will ensure that no sector is left behind, no country is left behind. But most importantly, for international partnerships, is not to say, okay, this is what the country needs. We, as Africa CDC, we've worked with our partners, we've worked with countries to define what the priorities are. We want our priorities to be heard when investments are being made, when resources are being mobilized to support LMICs. And lastly is the people of the continent. I think this webinar is timely. Well done to you, Dr. Maruta and Dr. Watipaso. As we move into November now, we are ready for the World Antimicrobial Awareness Week. Now, this is no longer the story of what should Africa CDC do? What should ASLM do? We are about 450 something people on this webinar. It is our responsibility, our shared responsibility, to make sure that the message of AMR did not stay in New York, but came back to Africa with us, came back to the continent with us. It's time to say that message. It's time to make AMR as relatable as possible. So back to you, Dr. Tokmore, and I hope I was able to cover some of the interventions you needed.
Thank you very much, Dr. Wande, always very eloquent and also speak passionately about AMR, and it's a pleasure to have your remarks. And your remarks, as you say, are coming 1 month after the UNGA declaration, and it's very timely. And one of the things you have mentioned, which we need to celebrate, is that in Africa now, we have really been able to define what this AMR problem is, quantify the problem, and make it very clear in terms of what are the needs for us going forward. And you mentioned one very important thing to say, without proper investment that is guided by those priorities that we have identified in the region, we may not be able to move far. And this really ushers us into my next very important guest speaker, talking about sustainable resourcing and also responsible financing. Anything cannot move without being oiled by some dollars. Resourcing for our plans is very critical. I would like to call upon Dr. Joanne Pires from the World Bank to also share with us their perspective as one of the multilateral partners on the role of multilateral donor and funding institutions in translating the declaration into action. In the next few minutes, Dr. Joao, you can also just give us your reflections on this. Thank you.
Thank you so much, Dr. Tokmore and colleagues. Let me first extend my kindest regards and thank the Honorable Minister of Health of Malawi for taking the time and provide such an inspiring intervention in this very important webinar. I also want to thank the organizers and my fellow panelists for this opportunity to speak. I would like first very quickly highlight 2 points I think are extremely important from the declaration: the need for multi-sectoral, cross-sectoral and interdisciplinary efforts, as well as sustainable financing to really improve the regulatory frameworks and accountability of countries for this very important issue. It's a matter of saving lives, as many have told, and this is an urgent and imminent crisis, one of the silent pandemics, we could potentially say. At the World Bank, we have been putting One Health, and more specifically AMR, in the front of our agenda. More than a decade ago, in the aftermath of the Ebola outbreak in West Africa, the World Bank launched a significant investment, the REDISEP program, which is a regional disease surveillance systems enhancement program, which really focused on AMR, extending to 16 countries and investing more than 670 million in emergency preparedness and response, with a really focused effort on the One Health and establishing One Health platforms to really bring together the 3 human, animal, and environmental health sectors and set forth integrated planning for AMR. Immediately after the COVID-19 pandemic, we felt that that effort was not enough. There was new threats coming every day, and AMR was getting scarier and scarier. So the World Bank started the process of designing a new regional program, or 2 regional programs, one for East and Southern Africa and one for West Africa, to really invest strongly in areas of health emergency preparedness, response, and resilience, with a focus on the One Health agenda. In September 2023, the World Bank the World Bank Board of Executives approved a large program that is going to extend the next 5 to 7 years and is expected to drastically improve the multi-sectorial preparedness and response efforts in Eastern, Central, and Southern Africa. The program provides 1.5 billion in credit and grant financing, and currently has engaged 8 countries, including Malawi and many other countries in Eastern and Southern Africa, as well as 2 large regional institutions, XHC and IGAD. The program really fosters strong regional and multi-sectoral collaboration for robust health security, with the One Health agenda at its heart, and focusing on 3 key aspects and investments that many have spoken about. 1, generating high quality evidence on AMR prevalence. We cannot fight what we don't know. So here really countries are using this financing to have national representative AMR surveys supported by WHO, making sure that we have improved laboratory systems and data management. Second, strengthening AMR surveillance and diagnostic capacity, especially expanding subnational sentinel sites to strengthen AMR surveillance, focusing on digitalization, innovative approaches, and expansion of whole genome sequencing and susceptibility testing. Lastly, building really skilled and competent multidisciplinary health workforce is going to be critical for this fight. I'd like also to mention, I know I'm short on time, but I think there's a very, very important point that needs to be made. It was highlighted in the declaration, which is on substandard medicines and the fight against AMR. In order to really advance the global agenda to curtail the rise of AMR, we must also address that the reality that substandard and falsified medicines are being manufactured, procured, and imported illicitly. Mechanisms for fostering reporting from local populations suffering from the fate of these substandard medicines needs to be instated. Regional harmonization around risk-based sampling methods for post-market surveillance are required. I'll just conclude my intervention highlighting that the World Bank, through our investments, is extensively engaging in multi-sectoral policy dialogue at the national level to ensure that country and regional investments complement other public investments, exploit synergies, and minimize duplication of efforts. Opportunities such as this one are critical to foster cross-country collaboration, engagement with regional economic communities, development partners, and others, such as the African CDC and the SLM. Thank you so much for the opportunity. Let me get back to you, Dr. Talkmore and Nabil. Thank you so much.
Thank you very much, Dr. Joao Pires. We are very, excited by the interventions that you have mentioned, and that the World Bank has put top priority in front of their agenda the issue of One Health approach to an integration of approaches and interventions, particularly around AMR, with the 670 million investment already made. And we're also excited about the two regional programs that you mentioned to the tune of 1.5 billion, which our African Union member states have really benefited from. You spoke about strengthening high-quality data. You speak about strategies for AMR surveillance and diagnostics. And lastly, building skilled workforce resources. So now to tie up our discussion, I would like to invite in the last 2 minutes or so, Mr. Ndlovu, to really speak about, now that we've heard the message from UNGA, what is contained in the declaration. We have heard this voice from the countries in terms of the priorities. We have heard the roles that Africa CDC would like to play, the World Bank, the realignment with the strategies for PEPFAR in their global health strategy. So from now, where do we go? What are the take-home messages, Mr. Ndlovu, that we need to take from this meeting going forward? Over to you.
Thank you so much, Dr. Talkmore. I want to make some few closing remarks. I really want to appreciate the Honorable Minister for being in this webinar. I want to appreciate even the PEPFAR colleagues for the remarks. I also want to thank Africa CDC even for your leadership in the continent. And I also want to appreciate the World Bank for really providing the much needed resources so that we can tackle AMR in the continent. I think as I close, I think there's a big question that we want to really talk about today is, why is this declaration a game changer for public health across Africa? I think I want to close with those remarks today. Why this declaration, and where does it leave us as a continent? I think I'm just going to mention briefly just 4 things. Number one, it's a timely declaration because it is bringing us and putting us to have collective action. I think that's number one, and that's most important as a continent, to really address the issue of AMR in the continent as one. I think that's one important point that I want to raise. In that sense, it is bringing us together to harmonize our efforts in the continent. I was very excited to hear even from Dr. Yewande talking about some of the important successes, best practices that we are beginning to witness and see in the continent. So I think that is very important even to talk about and sing about, even as a continent, that we are making some progress, because as a continent, we do have similar problems and we need to share some of these best practices and even harmonize some of our approaches to addressing the issue of AMR across the continent. I think secondly, it has put the continent on the spotlight in terms of organizing ourselves and defining our priorities as a continent. So that is very important that we have this one unified voice as a continent. And at the same time, we believe that this is going to actually even attract the resources. We are happy to hear from World Bank some of the resources that are being set aside to address this issue of AMR. So this declaration is also highlighting the need for resourcing, the need for funding, for financing, the need for partnerships that the continent will need to really address this issue. So I think that's one thing that really is a game changer, even coming out of this declaration. Lastly, for me, as leading the organization, the African Society for Laboratory Medicine, I think this declaration is also putting a huge spotlight in terms of how important diagnostics and laboratory services are as far as the surveillance of AMR. So it's actually showing that diagnosis is going to be one of the strongest pillars if we are going to address AMR. We need to strengthen diagnostics. We need to strengthen lab services to generate high quality evidence and also to really provide that guidance in terms of what are we dealing with as a continent. So that is, I think, a game changer for me coming out of this declaration. So with those remarks, I really want to appreciate and thank all the distinguished guests, speakers, the participants for being part of this webinar. Thank you so much, and over to you, Dr. Tokmo.
Thank you very much, Mr. Ndlovu. I can't say it better than you have said why this is a game changer. It's timely declaration, and it's making us take a collective approach. So everyone, hands on the deck. Secondly, it has called upon us as a continent to be organized, speaking from one voice, and really define our own problem, and define how we think the solution should be provided. And of course, the importance of diagnostics, laboratory services, in ensuring that our surveillance systems are strong and we collect the required data to continue to inform us how we are progressing. With this, I would like to thank all our distinguished speakers, the Honorable Minister from Malawi, our friends and colleagues from the World Bank, from PEPFAR, from Africa CDC, and the over 450-something participants that followed us today. This is not the last time you hear from us. We'll be calling you upon again to continue to debate and to discuss this issue of AMR, which is no longer a distant threat, but a threat that is today. Collective effort is needed, organizing ourselves, strengthening diagnostics and health systems. Thank you very much, and enjoy the rest of your day.